Hello, I'm Dr. Steve Scionti. I'm the medical director for Vituro Health. We're here in Sarasota, Florida at the Vituro Health HIFU Center of Excellence. Today we'll be performing a MRI fusion-guided targeted HIFU ablation for a 61-year-old gentleman. This gentleman presented to me with a PSA that was elevated to 7. He had a positive family history for prostate cancer. We obtained a 3 Tesla multi-parametric MRI as our first test. This demonstrated what we would call an index lesion, that is a significant tumor sitting on the left-hand side of his prostate in the apex to mid-gland. The tumor was well contained within the prostate, and the MRI was suspicious for a fairly moderate to even possibly a high-grade prostate cancer. We performed a systematic as well as a targeted fusion biopsy using a technology known as Artemis. This allows for a very precise marriage or integration of the MRI images directly onto a 3-dimensional ultrasound so that biopsies can be precisely targeted to the area of MRI abnormality. We then use the Artemis software to map out a biopsy pattern throughout the rest of the prostate. This resulted in the findings that this gentleman did have prostate cancer. The Gleason grade was 7, which is an intermediate grade, and the cancer was targeted and found exactly where the MRI said it was. In other words, the tumor was confined to the left apex to mid-gland. The rest of the prostate was totally negative for prostate cancer. So this brings us to a real dilemma today in prostate cancer treatment. Do we treat the cancer or do we treat the entire prostate? You see, prostate cancer has become quite controversial. There's a real concern around the United States that our treatments are excessively complicated. That is, we're causing significant problems with urinary incontinence or leakage and/or sexual and erectile dysfunction. And this is an area where it's really hard to know that we really change longevity with a lot of our prostate cancer treatments. So we impact a burden to many of our patients in which we really have overtreated a great number of men. And so this led the United States Health Preventive Task Force panel to really take a negative view about PSA screening. This negative view was because there was a concern that the harms of treatment outweighed any benefits. You see, using precise diagnostics today and now having the ability to do a very precise targeted treatment of the tumor, we're going to be able to treat our patient today in a way that we destroy the tumor with an excellent efficiency, but very important, we're going to be able to preserve with a very high degree of likelihood his urinary and his sexual function. I think a targeted MRI-guided fusion HIFU ablation is the perfect middle ground today. This is going to allow us to destroy the risky region of the tumor. That is, we're going to take the risk away, and at the same time, we're going to preserve for him his quality of life. This technology is really the culmination of many, many years of work in which we're able to marry together advanced diagnostic techniques such as MRI, Artemis, fusion biopsy, that is targeted biopsy, and now marry this entire diagnostic technology into our HIFU treatment platform. So now we can understand exactly where the cancer region is in the prostate and direct a very high density of energy right to that tumor. This allows us to get that perfect marriage, that perfect blend of treatment and minimal side effects. So as we go through the case today, we're going to be able to demonstrate some of the technical points of performing an MRI-guided fusion HIFU ablation. Okay, so now here we're in the treatment room at our HIFU treatment facility. We're using the Sonoblate machine. The Sonoblate machine has incorporated into it a fusion software platform called Artemis, and we'll see that today as we approach this case. Now, let's have a look at the patient setup. Our patient is set in what's called the lithotomy position. The ultrasound probe is placed into the rectal canal. Our patient's completely asleep. Okay? This is the only way that I interact actually with the patient, is to place this transducer to deliver the energy and take the ultrasound pictures into the rectum. Beyond that, there's no other interaction at all with the patient. Everything else is controlled from a computer module. Okay, so now let's have a look at the module. The prostate has been photographed here with ultrasound in both what's called the transverse and the sagittal plane image, and we're going to think about how we want to approach this tumor. His cancer is left-sided only. It's in the region here, as outlined by my mouse. We'll see that once we do the MRI fusion. We're going to treat most of the left side of his prostate, most of the left side. The MRI fusion technology is going to allow me to see exactly where the tumor is so that I can place a very high concentration or density of energy onto the tumor. So knowing where the tumor is going to allow me to concentrate energy and get a much better destruction or ablation of the tumor. So the way I'll approach this, we'll treat the left side of the prostate in 3 zones, and the top zone we'll treat initially. This will allow for some prostate swelling to occur. At that point, the prostate will have reached its somewhat swollen size. At that point, we'll then do an MRI fusion. We'll overlay the MRI images onto this somewhat and slightly swollen prostate. That's going to give us a much more accurate mapping of the tumor to the ultrasound to allow us to go forward and do the treatment. So I'm going to go ahead and I'm going to plan out this top or anterior zone, and then we'll have a look as we move into treating the anterior zone. At this stage of the procedure, we've planned out the therapy in the top zone or the anterior zone of the left side of the prostate. And the treatment is demarcated by this box. Every dot shows a zone that's to which energy will be delivered. Now on the what's called the longitudinal or sagittal plane, the transducer is delivering energy moving from the apex towards the base of the prostate, running down an alleyway. The colors are very important. This is what we call tissue change monitoring. And this measures the response of the tissue to the HIFU pulse and assures me that we're delivering an adequate amount of energy to the target. That big white splotch tells me that that's a perfect level of energy being delivered. Thus, I have real-time feedback that the energy delivered to the targeted tissue is appropriate to kill the targeted tissue. This requires a significant amount of monitoring and training. Even though we're on cruise control, we're carefully monitoring these controls to assure the energy is being delivered exactly to the area that I want it to go. And we're also assuring that the dose of energy is appropriate to get an excellent tissue response. Okay, so we're coming back into our procedure now, and we've completed delivery of energy to the very top part of the prostate. This is the region here outlined in red that sits right over the top of the tumor area. Now in ultrasound we can begin to see the tumor area. And we're coming right along the outskirts, right along the top of the tumor. We know that prostate cancers have an area of abnormality that has some generally lower grade cancers surrounding the major tumor, or what we call the index lesion. So when we talk about a targeted treatment, we want to treat obviously the primary tumor, but we want to destroy the zone, the neighborhood right around that tumor. So to use an analogy, we don't only want to destroy just the one little area, we want to destroy the neighborhood where the tumor lives. And we want to do that in such a way that we're not destroying critical structures. So in this example, the urethra, the urinary channel, is right in the center, and we're nowhere near it. We've preserved that. You can see the urethra right present there. The nerve bundles live down in this region where my arrow is. And so the energy is nowhere near the nerve bundles.
And so this is going to allow us to destroy this region of prostate with literally no collateral damage or side effects. The next stage of this procedure will now be to treat the middle zone of the prostate, right through here. And here we're going to use the guidance of MRI integration, MRI fusion. So I'll bring you through the process and show you the steps of how we marry or integrate the MRI model into this ultrasound model so that we can get a precise targeting of energy to this tumor region. We can see it somewhat by the ultrasound. I think you'll find we'll be able to see it even better when we overlay the MRI images. The next part of this procedure will be to perform the MRI to ultrasound fusion. Our Sonoblate machine has the most advanced software program today available in the United States. And it uses this technology called MRI fusion. Today I'm using something called Artemis software, which is made by Eigen Medical. And it's the exact same software package and platform that I use to do my MRI guided or fusion targeted prostate biopsies. We've imported the MRI images now into the Sonoblate machine. That's been done prior to the start of our procedure. The first step in the fusion process is going to be to perform what's called a segmentation or an outlining of the ultrasound images. So in this upper panel, we see the transverse image of the prostate as obtained by ultrasound. We also will see in the bottom panel what's called a longitudinal or a sagittal image. My first step in fusion will be to using these red dots to outline this prostate. Once we've outlined the transverse images, our next step will be to outline what are called the sagittal or longitudinal images, much as you see me doing right here. So as I work through this, we're outlining from the ultrasound exactly the boundaries of the prostate. This is called segmentation. The software now is creating a segmented ultrasound model, which I'm going to refine and make sure it corresponds exactly to the MRI images that I've previously segmented. So now we've completed the ultrasound segmentation. That is, the green line follows the contours of the prostate exactly, all the way from the base of the prostate, this is the base and the seminal vesicles, through the mid-gland of the prostate, now through the extreme apex of the prostate. And as we scroll through these images, you'll see the segmentation is very precise. And now there's the extreme, what we call apex of the prostate, lined up beautifully. We've got a segmented ultrasound volume of 34.14 cc's. Our next step in the fusion process is to bring in the MRI pictures that we previously have outlined. And so in this image, we will see our actual MRI pictures present here. This is an actual MRI image from this patient, and the green line shows the outlining that I have done previous to this procedure. So the MRI images are outlined similar to what I just did with the ultrasound images, and you can see that it's a very precise outlining. Now, the volume that we segmented on the ultrasound is 34 cc's. Likewise, the volume that we've segmented on the MRI is really virtually the same. That means we've outlined the prostate in a very similar way on ultrasound and on MRI images, and we can expect that we're going to get a beautiful fusion or overlay. Our next step then is going to be to assure that the images on ultrasound correspond to the same images as on the MRI. This is called a rigid registration process. The MRI image seen on the left-hand side of the screen, ultrasound image, and the question I have to determine, is that in fact the same image? The easiest way to do that is to go to the extreme apex and make sure that the extreme apex corresponds exactly. This first step in fusion then is called a rigid registration process. And so I'm telling the software that this MRI image seen here with these two reference points corresponds exactly to the ultrasound image, and point 1 corresponds to point 1 and point 2 corresponds to point 2. As I've done that, I'll finish the rigid alignment, and now as I scroll through these images, we are looking at exactly the same pictures. Now that I'm satisfied that we've got a very nice registration or agreement between MRI and ultrasound, now we'll do what's called the elastic fusion process. So in this stage, the software is going to morph these two images together, MRI to ultrasound, and it's going to give me a very precise overlay using advanced computer software. Essentially, we're taking two very similarly segmented images, MRI and ultrasound, and we're using advanced software to morph the two images one onto another. And you'll see that the model of the prostate shown in brown on this screen is an exact model of the prostate created from this image fusion, and the red area seen is the area tumor extending from the apex towards the mid-gland of the prostate on the left side. The bottom part of this picture is the left side, the top part of this model is the patient's right side. Now that I'm happy with that registration, I'm going to hit Finish Fusion, and now we're going to get a fused image. Now we're into the treatment mode. Again, we're treating the middle zone. We have an MRI overlay. The dotted line is the margin or the safety halo, and you can see that it's quite large. And you can see how in this transverse plane we're going to treat this area right across here, including the safety halo. If you look down at the right-hand image, you'll see the red circles here. This is a projection of the tumor onto the MRI. So we're delivering energy directly over the top of the tumor at this point, and the dotted line showing the safety halo zone or the margin. And we've taken a bit more margin towards the back of the prostate. Since this area has really no consequences to deliver energy to that area, it's quite safe to do that. But you'll notice how the energy is precisely confined, precisely conformed to the capsule or the margin of the prostate. One of the advantages of the Sonoblate device that I'm using today is precise, conformal direction of energy to match or correspond to the exact prostate, as well as you can see the area of tumor now. The area of tumor is being incorporated now into the treatment. And we've got a beautiful response here shown by the orange coloring right at the tip or top of that tumor. We'll continue this process in the middle zone until, if you look at the bottom right-hand corner of the screen, all these little gray dots are filled in. This demonstrates our treatment progress. We've now delivered treatment to the planned or targeted area in the mid-zone of the prostate. One of the advantages of the Sonoblate machine, it allows me to go back to this area and add additional energy to the tumor region, as well as to add additional energy to any targeted areas that didn't experience enough of a response to the energy. So in this colored scenario, the orange and the yellow coloring demonstrates good tissue response. You see an area of green in which there wasn't quite enough energy to that area. I can go back and I can dial that in for more treatment. But the most important thing I want to show you here is that this region right here where the tumor is bulging up into the anterior zone, this is a region where the most significant area of tumor is. And the technique that I've developed allows me to take the area where the tumor is and put increased energy concentration on the tumor region. So knowing exactly where this tumor is going to allow me to put more energy over this area right here. So I'm going to go ahead, I'm going to acquire what's called an update of new images, and I'm going to modify or refine this treatment zone to the middle area before I progress to the posterior portion of the prostate. We have now refined the treatment plan in the middle zone of the prostate. If you look at the diagram in the lower right-hand side of the screen, you'll see that the gray dots are areas that I've designated for additional treatment. And this corresponds to exactly where the tumor is bulging up into this middle zone. So we're adding additional energy. If you look at the screen on the sagittal section where my arrow is, right over the tumor, we're putting additional energy. We put a double treatment right in that area, and now we're filling in an area that didn't get significant change. And again, additional energy over the tumor region, as you can see right here. This is the importance of knowing exactly where the tumor is. It allows us to increase energy delivery to the most important part of the prostate that we want to treat. That is, where the tumor lives. All right, so now we're going to come to the most important part of this procedure, and that's treating the posterior or bottom zone of the prostate, which is the region where this tumor is principally located. Now we know this is located in the apex extending to the mid-gland of the left side of the prostate in the posterior or bottom portion peripheral zone. We did our MRI fusion in the middle zone of the prostate. If we find that there's been a significant change in the prostate size or shape, it will be necessary to redo the fusion, that is to redo the MRI to ultrasound marriage or integration or overlay. So what we're going to do is we're going to look at the screen at this point. We've changed to our transducer. That's the 3 centimeter focal length transducer that's going to allow us to treat the posterior zone of the prostate. We've acquired our set of 3-dimensional ultrasound images, and now we're going to look at the overlay or outline of the MRI and see how well it conforms to the ultrasound shape. If it conforms well, we'll be able to proceed with planning. If it does not conform well, at this point we'll have to repeat the fusion process that we did in the middle zone. So now we'll turn our attention to the screen. You'll notice that the ultrasound images and the outline of the MRI don't exactly match. That's because we've changed the location or the height of the prostate on the screen. So we're able to use a mechanism where we can realign the outline of the prostate by MRI, shown by the yellow line, to the ultrasound image. And I think that'll just about do it. That's a nice alignment. And as I scroll through, we see that we still have a very nice match of the MRI outline to the prostate ultrasound image, which means that this fusion still aligns nicely. And because the fusion still aligns nicely, we will not need to repeat the fusion step. We still have an accurate overlay of MRI to ultrasound. Now you can see in the sagittal plane image on the right-hand side of the screen, you can see the tumor off on the left side, and it's right in the target of this dark blue zone we're going to treat. We're going to apply margin throughout here. In fact, we're going to put even a bit more margin towards the base of the prostate, as there's absolutely no side effect penalty to do that. As I scroll through, you see that that's an area it might be very possible to not apply enough treatment to if we didn't know that was a tumor region. That's the extreme apical tip of the prostate off to the extreme left side. Very easy to miss that area. But knowing exactly where the tumor is allows me to ensure that energy is delivered to the target tumor, and additionally is going to allow me to increase the dosage of energy to that targeted tumor. So now I'm going to go ahead, I'm going to design in the treatment, and I will bring you back to see what the design treatment looks like in this posterior zone. We are now into the treatment phase of the posterior zone of the prostate. And on this image on the right-hand corner of the screen here, you can see that the red line outlines the tumor. The dot is the actual focal point of the energy, and you can see that the white splotch here is the concentration of energy right at focal point, and you can see the maximum response is right over the tumor. And I've done that by adjusting my power levels and titrating and adjusting the energy I deliver very precisely to get the maximum energy concentration at focal point. And additionally, knowing where this tumor is allows me to ensure that we've got an appropriate delivery of ultrasound energy to the targeted tumor. I know this patient is going to have an excellent response to treatment. I know that because I can see directly the response of the tissue directly on the tumor. This technique we're using today of MRI-guided ablation, as well as the technique of modulating the energy to produce the ideal treatment response, gives me excellent assurance that this patient is going to have a wonderful treatment to his tumor. And you can see here as we go to this area, the focal point, the energy concentration is right on this tumor. That's exactly what we want to see. It is possible, I believe, to achieve better than a 90% negative biopsy rate or elimination of tumor rate using these advanced techniques. This compares very favorably to any other technique we use for the treatment of prostate cancer. But here's the difference. The difference is that we're able to confine this energy in such a way that we minimize collateral damage. So for example, in the upper left-hand side of the screen, you'll see the urethra. There is no energy near this urethra, free of energy. The neurovascular bundles are down in this corner, right where my arrow is. And again, you can see the energy is confined to the edge of the prostate, but it's not out here into the neurovascular bundle. I can tell this gentleman with confidence that he has a 95% likelihood of maintaining excellent erectile function. I can also tell him with confidence that he has less than a 1% risk of requiring a incontinence or leakage pad in his undershorts. So precise targeted therapies, I think, achieve an excellent balance between treating the tumor and minimizing the quality of life related side effects that are so pervasive with our typical prostate cancer therapies. Bring you back now to the final stage of the procedure. In this final stage of the procedure, we've completed delivery of treatment to the bottom or posterior zone of the prostate. And I've reacquired some images, and now we can see the area literally right over the tumor, okay? And what I'm showing you here is that this area has already been treated, and now I'm reapplying energy right over the tumor. This allows me to increase, in fact, to double the energy density on the most significant portion of the tumor. So as I look at my underlying tumor, you can see that the red area here, as outlined by the tumor, I've retargeted that area for additional energy. And as we scroll through these images, you can see that the tumor itself has been retargeted for additional energy to be placed at that area. What I have found is that that really does increase the ability to get a very effective tumor destruction or ablation. So if we look at the bottom right-hand corner of the screen now, you'll notice that the region of the tumor right through here has been retargeted, and right at the edges where the prostate is swollen out a little bit, I've added just a little bit of energy around the periphery. But notice that the region around the neurovascular bundle, again, I'll focus you to the upper left-hand corner of the screen, right through this area, has not been treated outside of the prostate into the region of the bundle. That's important. And if we look at, for example, in our sagittal plane, you'll notice that the treatment preserves the urethra, preserves the neurovascular bundle, and allows us then to, again, preserves the neurovascular bundle, preserves the urethra, allows us to get a very high concentration of energy exactly where the tumor is, with a large safety or halo margin where there's really no consequences to adding that. So again, I expect this patient to maintain excellent function, and I fully expect an excellent treatment response to what we're doing. So now we're getting ready. We're turning the machine back on. We'll deliver the additional energy to the periphery and over the tumor. The next 5 minutes will be concluded with the procedure. Then I'll be back to talk to you to summarize our treatment. We're now at the conclusion of our procedure. You'll notice on this particular screenshot, you see an area of the tumor. And you can see that there's been excellent treatment applied over that area. So for example, I'll show you one more time. There's the region of tumor, and it's beautifully covered by the treatment. There's a large safety margin here. Our diagram shows excellent distribution of energy. The oranges show temperatures that suggest excellent, excellent treatment. So today, we've been able to accomplish a very precision, personalized, targeted treatment for this patient. It started with advanced diagnostics, in which we used an MRI, an Artemis-targeted biopsy to map out the prostate, make sure biopsies went through the MRI suspicious regions. We confirmed that the MRI areas of abnormality were in fact cancerous. That was a Gleason grade 7 cancer. The remainder of the prostate was negative. We do know, I'll remind you, that there is an area of abnormal tissue that surrounds the MRI abnormality. So we took that MRI designed plan, loaded it into our treatment machine, the Sonoblate HIFU machine, and now designed a customized treatment for our patient today, in which we put a very high concentration of energy on his tumor. We treated a large safety or halo zone around it. We avoided the urethra. We avoided the external sphincter, which is the control valve. We avoided his neurovascular bundles. He's now going to awaken from his anesthetic. He'll have a catheter in his bladder for a few days, but he'll travel back to his home in the east coast of Florida tomorrow without any difficulty, and within a few days he'll be back at full activity. In fact, tonight, 3 or 4 hours from now, once he's awakened, I fully expect he'll go out and have a nice dinner with his wife and celebrate the fact that he's now cancer-free. So thanks for tuning into our procedure today, and I hope you understand that this is a game changer. This is a revolutionary treatment today that allows us to use the most advanced technology that we have and achieve a very personalized treatment solution for our patient.